Hi, this is Damian Marucci. I'm a plastic and reconstructive surgeon and I'm a clinical associate professor at the University of Sydney. This video is about scarring after surgery and how to get the best scar outcome. Now, all surgery involves scars. Scars are permanent and they can be distressing to both you and your surgeon. But today I just want to talk about the top 5 factors that can improve your scars after surgery. So the first thing is time. No matter what you do, your scar will improve with time. Wound healing is a process and it goes on over a period of 12 to 18 months. So patience is very important. There are many things you can do to try to decrease the amount of time that a scar takes to mature, and we'll go through those with the next 4 steps. Avoiding the sun is very important after surgery. If the scar gets sunburned, it can always be a different color to the surrounding skin through increased production of pigment. So it's important to wear sunscreen and a hat and do everything you can to stay out of the sun after surgery, especially in the first year or 2 when your scar is still remodeling. A third factor that can improve scar outcome is silicone. Silicone works by keeping the wound well hydrated, and a well hydrated wound is very important. In the days after surgery, when I put sutures in, for example, a scar on the face, I'll advise the patient to keep the wound greasy, either with Vaseline, but later on you can use silicone. Silicone can be used either as a gel, or alternatively, you can get silicone sheets. That's ideal for wounds on the trunk or legs where you don't want to have grease getting onto your clothes. The fourth thing that can improve a scar after surgery is massage. It's important to wait until the wound is fully healed, and I advise my patients not to begin massaging a wound until at least 3 weeks after the surgery. The kinds of things people use to massage the wound with are either bio oil, vitamin E, or silicone gel. Massage has been shown to break down scar tissue and improve wound remodeling, ultimately resulting in a better scar outcome. The fifth and final factor that does work for many patients is simple paper tape. Paper tape can be bought in the supermarket or over the counter at the chemist. It's cheap, and it can be applied directly to a wound, especially on the trunk or limbs. I advise patients to leave the paper tape on, to shower normally over the top of it. If it hasn't fallen off after a week, then replace it after a week. Other than that, just leave it on until it falls off, and then when it does fall off, replace it with a new piece of paper tape. So, they were my top 5 factors for improving scars after surgery. I hope you found this of use.